Over the weekend, the Sydney Morning Herald reported that 13 people working in tunnelling for CPB contractors on the M6 Stage 1 project have received a silicosis diagnosis. Silicosis is an incurable lung disease caused by exposure to silica dust. The disease can be fatal. SafeWork New South Wales first started investigating CPB contractors on this matter in 2023. Following a SafeWork inspector finding that the contractor had not disclosed 12 silicosis cases. Employers are required to report to SafeWork when a worker is suspected by a doctor to have a condition caused by silica exposure. The cases were not necessarily caused by work on the M6 Stage 1 project. The Australian Workers' Union have advocated for the health and safety of tunnelling workers for many years and raised the alarm on the danger of exposure to silica dust. The AWU's Assistant National Secretary, Chris Donovan, noted in the article that no prosecutions have been made against a company regarding silica exposure. Minister Kotsis is quoted expressing that SafeWork is expected to, and I quote, strongly enforce legislation to protect workers. Minister Kotsis also strongly reaffirmed the government's zero-tolerance approach to employers who fail to protect workers from exposure to high levels of silica dust. Addressing the dangers of silica dust is of the highest importance to the government. It cannot be resolved overnight, but we've begun work to address it. For example, earlier this month, the government established a new expert task force to target the health of tunnelling workers exposed to silica. This is on top of the silica compliance team the government established last year. We are funding $5 million towards the Asbestos and Dust Diseases Research Institute for silicosis research and a support initiative. The federal government also instated a ban on the importation of engineered stone products with 1% or more silica, and a ban on the use, supply and manufacture of engineered stone products, which was a world first. Further, last month I joined Minister Kotsis at the launch of the $2.5 million Lung Health Mobile Clinic, also known as the Lung Bus. The brand new bus will be travelling across the regions, offering free screenings for lungs, which can assist with the early detection of dust diseases like silicosis. Lung screening services are also available in Sydney. Mr. President, unions' ongoing advocacy on these issues is why we see the change that are occurring today, and the AWU is at the front of this issue. I congratulate them for their ongoing advocacy and for the Minister's initiatives.
Thank you. Is anyone